When infants and children have difficulty eating because of physical or behavioral conditions, there can be serious health problems as a result. The Functional Feeding Program at the Children's Institute offers hope. Tawana Denmark brought her daughter Ariana to the Functional Feeding Program after Ariana had transplant surgery.
My daughter is currently in the feeding program at the Children's Institute. She just had a transplant on May 13th. She was a multivisceral transplant, meaning that she got a small intestines, liver, pancreas, and a stomach. She was born short gut. She never ate before, so being now that she just had her transplant, she's in the feeding program currently here. Every day was a struggle because I didn't know if this day would be her last day, if she would make it till the next day. It was kind of hard, and it was really a lot to bear on, because when she was diagnosed with short gut, they had came and told me that my daughter may not live, she may not make it, and that's the hardest thing for a mother, a parent to accept that your daughter may not be here another day, but she is, and it's rewarding. It's a feeling that you really can't describe.
Once Ariana recovered from her transplant surgery, Tawana wasn't sure what to do next. That's when she brought Ariana to the Functional Feeding Program at the Children's Institute. A team of therapists worked with Ariana, learning her likes and dislikes, and gave Tawana helpful tips and techniques to help her daughter reach the next level in her recovery.
When she had the transplant and she was feeling better, it's kind of like, what do I do now? Where do I go? And being that she's never eaten before, I knew that she would have the oral version, and it was kind of scary for me to have to face that, to have to go in and say, okay, Ariana, time to eat. And I knew she would cry and scream. So now I'm coming here and having them work with her, taking their time with her, learning her inside and out, learning what she likes to do, what she doesn't like to do, what approach to take. And I think that's what the feeding therapists and all the therapists over here do. They learn your child. They learn your child's personality. Okay, they look at her, they evaluate her and say, okay, what approach are we going to take with Ariana? And they took the right approach, because now she's eating. Now she's doing all of these things that I didn't think she would do.
A transplant patient would benefit from the functional feeding program in many ways. Most of the transplant kids that we get are usually small bowel or multivisceral transplants. We do occasionally have children that have had cardiac transplants, but for the most part, these kids are sick at a very young age. They never learn how to eat. They can't eat because their gut won't absorb before their transplant. They become transplanted, and then they're stuck with tube feeds or IV fluids, and therefore a transplant kid benefit greatly by coming inpatient to the functional feeding program so that they can get intensive daily therapies and learn how to eat and teach their gut how to absorb.
Before transplant, she didn't really want to do, and she had developmental delay, so I was just expecting her just to kind of like move along slow, but surprisingly she's moving along really fast with the different therapists. The therapists are wonderful. They work with her, interact with her. She gets excited when she goes with different therapists. It's just a different experience now, and I'm seeing her doing things that she's never done before.
The Functional Feeding Program at the Children's Institute provides help for children through a feeding clinic for infants, an outpatient clinic, outpatient evaluation and treatment, and inpatient care. They can design and implement a treatment plan for children who have not responded to other programs.
For children coming into the program, we use a lot of different techniques. Because we have all the disciplines here, we are integrated in the care. We will sometimes co-treat, which is a nice ability to do. We use different techniques like sensory integration. We use messy play.
And the feeding program is wonderful because she's taking food, she's allowing food without resisting it, which would have been a battle for me back at home if I had to do that by myself. But they work with them and they take their time with them, and the therapists here are just really, really great.
I think not only the child but the family on whole benefits from our functional feeding program. I think that when you're treating the family needs as well as the child's needs, you have a much better success rate and far better outcome.
Now it just seems like with the transplant and coming here, it seems like she's just taken off, and it's indescribable how I feel, how it makes me feel to see her.
The functional feeding team provides support by teaching families a variety of techniques and skills to help them manage their child's feeding program. This support continues through discharge planning, outpatient consultation, and follow-up care.
When a child goes home, we want to make sure that the child and their parents are as prepared as possible to transition the new eating pattern and diet into the home with success. What we do here for the inpatient kids, we start them out in the meals, we transition the parents into the room, transition the parents into feeding, give them behavioral techniques, teach them how to puree foods if a child needs to go home on a pureed diet. We give them as much training as they possibly could get in order to feel confident and have the tools that they need to go home and feed their child as though, and keep everything as it was at the time of discharge. So before we discharge them, the parents are feeding all the meals by themselves with nobody else in the room. And when they go home, tend to do quite well.
There are not many hospitals like the Children's Institute in Pittsburgh. So being able to come here and transition from the hospital to come to the Institute, it was a really positive thing, because you're finished one step, but then you have a whole lot more to go. Transplant is kind of the easy part, but the feeding and the different things that you have to do after transplant, that's the hard part. It makes me smile just knowing that she's just accomplished so much. In the little time that she's been here, it seems like she has accomplished as much as a 5-year-old would do. She's just accomplished so much, and it's so rewarding to see her to do all of these things now.